So thanks for joining us, everyone. We're delighted to be here presenting in a virtual capacity. So to introduce ourselves, my name's Spod. I'm a practicing acupuncturist, but directly preceding my acupuncture training, I spent around 30 years working in IT, so building web-based systems, big databases, doing lots of data analysis. And so it's been quite interesting to pull those skills back into the world of acupuncture.
Hi everyone, good morning. My name is Nick. I'm a practitioner and researcher, and my real area of research interest is sort of leading on what Ian was saying earlier, is not so much in these formulaic, standardized, randomized control trials. I'm interested in knowing how much better patients get when they come in and receive treatments in real world clinical practice. And that's a big part of what motivated me to get involved with ACU-Track. Our statistician, Natalia, unfortunately couldn't be with us today. She's a professional medical statistician working out of the University of Southampton, and she ensures that all the data collected by ACU-Track, our new system, is analysed with extreme rigour. So welcome everyone. We're going to talk to you about ACU-Track today, which is our new patient outcomes tracking system, which has been specifically designed for acupuncture and traditional East Asian medicine for our profession. And in a nutshell, our goal was to develop a system to make it as easy as possible for practitioners working out there in your own clinics every day to collect and record your clinical results. Traditionally, this was done using paper forms, and there might be many of you listening that have done this, have spent time collecting data in paper forms, manually typing it up into spreadsheets like I was doing for years and years and years. And I feel your pain. It's a very difficult way to do things. We need to streamline this. These online systems are more than capable of doing this far more efficiently, and that's what we've done. We're moving these patient questionnaires off paper, online, and emailing patients their questionnaires automatically, so it's all systemized. So these systems are not new. They are regularly used in other healthcare professions. The NHS has had a national patient outcomes tracking program for over a decade now. All our related healthcare professions, such as physiotherapy, chiropractic, osteopathy, these kind of interventions, they all commonly use these kind of systems in their practice to record and monitor patient improvement and patient progress. To our knowledge, ACU-Track, this is the first system where we've actually developed this specifically for our profession. And we feel that it's very important to embrace this technology moving forward, because it has enormous potential benefits, both on an individual practitioner and clinic level, and also on a collective professional level.
So if you remember back to when conferences were face-to-face, so back in 2019, we had a small stand and we collected some feedback from the people attending. And it was all about, would you find it useful to have an online, a web-based or app system to collect patient data, patient outcomes? The feedback was largely positive, and it definitely showed that there was a demand. So off the back of this, we decided that ACU-Track would happen. We would make it happen. Now, one thing we were not prepared to do was to spend years and years developing a system, thousands of man hours, years to get the system to a point where it was fit for purpose and it was mature and resilient and all the things we needed. So we decided we would partner with an organization that we could trust and that had an established system that offered all the things we needed. It needed to be extensible, which means it could be configured to deliver what we needed it to deliver. It needed to be a mature, scalable, robust, all those really good IT things. It also needed to be GDPR compliant. So we partnered with Amplitude Medical. So they are the leading provider of patient outcome software for the NHS. We had a lot of faith in them, and so we went ahead with Amplitude, and we got the system built exactly as we wanted it to operate. and specific for our industry. And along the way, we were very lucky. We managed to get some grants to help us along the way, both from the British Acupuncture Council and from Oxlep. So how the system works is you add a patient to the system, either yourself, or you can send out a patient self-registration link, either from your scheduling software or just by email, or you could have a link on your website. The patient goes into the self-registration process, and the first thing they start doing is they get a consent form. So they have a big consent notice that talks about usage of data and all the things you'd expect to be in there. And they have to agree to the consent before they can then step forward and start putting in more information. So the key stuff we're looking for there is what's their main health complaint and all the other bits of information that you would expect on a patient intake form. And we have two intake forms, a short, concise one and a longer one with more sort of acupuncture, Chinese medicine, sort of TCM questions on it. So the patient can enter in their own words their health complaint. If they're experiencing pain, then we have a visual body chart, as you can see there on the slide, where they can click the areas that are painful. So if they say to you, I've got back pain, of course, as you can see there, lower left, that's great. Back pain itself is quite vague. We've all been there. You can also enter other information such as any other coexisting conditions, maybe what tests they've had, if they had an MRI scan and so forth.
So one of the main challenges we had in developing a system that was specific for acupuncture and traditional East Asian medicine is the quite unique clinical setting that we all work in. It's more akin to a GP practice than it is to a physiotherapy clinic when they're maybe just seeing a lot of musculoskeletal patients, almost exclusively that. We're seeing a wide range of health complaints. Julie did a great presentation earlier where they showed the kind of, a lot of these health complaints are chronic. They're affecting multiple aspects of a patient's life. They're not only in pain, their social activities are affected, their physical function, their mental health might be affected. Patients usually have more than one health complaint. All this thing, how do we even start kind of tracking this? So what we've done is we've developed a series of outcome plans, which are broadly designed to capture the wide range of the kind of health complaints that we would typically see in our clinics. And we're adding to these plans all the time. We started off with a pain plan, a well-being and pain plan, and a mental health plan. And we've just recently added a pediatric plan, which is specifically for monitoring outcomes in children and adolescent patients. And we're excited to keep adding new plans as we go forward. So how do these plans work? Once a patient has registered, completed their intake form, as Spod just showed you, it's then time to decide which plan to assign them on. You can complete the baseline questionnaire with the patient in clinic, or this can all be done remotely as well. So like I said, when a new patient registers their intake form, they're sent all of that by email. So they can do all of this out of the clinic. So it's really valuable for actually saving time in clinic. Once the baseline questionnaire has been completed, the system automatically sends all the follow-up questionnaires to patients via email at predefined time points. So it does all the work for you in terms of collecting those follow-up outcomes. I just see a question of fertility plan. Yes, that is one of our next goals, a specific fertility plan. So good question. We're working on it. Now, all our plans use validated questionnaires. This is very important. This is not just random questions asking patients how they feel. There's a whole process that goes into validating these questionnaires to ensure that the information collected from the patients is both accurate and meaningful. So our pain plan, nice and self-explanatory, a 0 to 10 pain scale. We've probably all got experience using this in our clinics in some form or another. This is perfect for just your acute pain condition or when pain's the main presentation, whether it's kind of musculoskeletal or even digestive. You just want a nice simple metric to track pain levels. This is perfect. Our well-being and pain plan is more comprehensive. As well as asking about patients' pain, it also asks a host of other questions about their physical function, their health and well-being, their mental health, their mood, energy levels, things like that. So it really captures a kind of broad domain of how a health problem is affecting someone. So this is really perfect for the types of chronic pain conditions we're going to see in our clinic, other chronic health issues, digestive issues, and things like that, where we can just really capture an overall patient health. So this is kind of our all-rounder, if you want, our really good all-rounder. It uses the PROMIS Global Health Scale. It's 10 questions. It's still relatively kind of short and easy to complete, and very applicable for a lot of the different things we see. And then finally, our mental health plan uses 2 questionnaires. The first is the GAD-7, which is anxiety-focused symptoms. And particularly in our pilot phase, we saw a lot more patients coming for anxiety. It's actually their main health complaint. So it's really important to have a specific questionnaire looking at anxiety symptoms. And the other one, next slide, please, Spod, is the PHQ-9, which focuses on depressive symptoms. So the mental health plan is not only great for patients who present with mental health as their main issue, but also if they've got another health problem that's directly impacting their mental health, such as a skin problem or PCOS or something like that, you can also put them on the mental health problem to assess their anxiety levels in association with a different health complaint. So we categorize and classify patients' health complaints when they first come in before they've completed their baseline questionnaire. So we use internationally standardized codes to do this, but the wording's very simple. Whether you have kind of an official medical diagnosis of generalized anxiety disorder or sciatica, or whether you're just broadly feeling anxious or you've got lower back pain, the patient and practitioner can choose the most appropriate term here, how long they've had this complaint for. And then in our follow-up forms, if you want to go to the next slide, Spod, we quite simply ask the patient, how much better or worse is this specific health complaint compared to when you first started your course of treatments or care? This is a great overall barometer of patient kind of improvement, gives the patient and the practitioner a really good gauge of where this patient's at and how much they feel that this specific health problem is improved, in addition to the other questionnaires. Here we can see that this patient's on a pain plan as well. So we've got the pain scores and the patient's own perception of their improvement.
So then just to recap, we talked about the patient self-registration process and then the intake form that they would complete. Just to add to that, once they've completed the intake form, of course, what that's done is it's saved the practitioner lots of time in clinic. So you're not having to sit and ask all those questions. What it doesn't stop you doing is reviewing the answers ahead of the first session, and then actually maybe cherry picking some of the points to actually pick up on with the patient when they come in. So we've done the intake form, we've got them in, we've chosen a plan to put on that's the most appropriate. We've chosen the more detailed version of what their main health complaint is. So then we're going to perform a treatment and we want to record the results. So the clinical notes feature on the system allows you to select the intervention or interventions that you may have undertaken during the treatment. So it could be acupuncture, could be moxa, herbs, cupping, etc. And then based upon which options you select, it then lets you put further information in. So it allows you to choose the acupuncture point or points that you've needled. If you've gone for, say, cupping, it allows you to indicate on the body chart which areas you've cupped. And interestingly, that person on the bottom right corner of the screen looks exactly like a person does after they've been cupped, apart from maybe the green blobs. Also allows you to enter maybe what additional lifestyle advice you've given the patient. It's quite slow on switching slides, so sorry about that.
No problem. So this is where we think the system gets really cool. A big criticism that we often hear from practitioners and students about research in the acupuncture field is that it's not very useful for me as a practitioner. Well, we agree, and we want to try and change that. Our goal is to make research clinically relevant for practitioners, and our real-time analytics features are really well placed to do this. So as you're monitoring a patient on one of these plans, you'll get to see in these visual graphs that we've got here on the system in real time, how they're progressing at each time point as their questionnaires get sent out. And then you can look at that in combination with your clinical notes that you've been recording. And you can see, are the patients improving? Fantastic. What kind of treatments were you giving to that patient? Maybe they're not improving, and maybe that's an opportunity for you to go and revisit your diagnosis or your treatment strategy, or consider something else that's going on in that patient's life, which might be preventing them from getting better from this particular health complaint. So in real time, as this data comes in on the patient's own words and how they're improving, you get to adapt your clinical decision making in real time. So we're really hoping it's going to be a very useful tool for practitioners to use, as well as just collecting the data for research purposes.
Thank you, Nick. So that's the detailed view of on an individual patient basis how they're doing with their treatment. The system's got an extensive reporting suite. So this allows you to take more of a helicopter view of the data across the board. So it allows you to filter the results based on maybe demographics such as age, medication taken, what treatments have been used, and it allows you to look at charts and graphs and see how maybe on a pain level they're performing, or the lifestyle advice given, etc. You can also maybe cut the results down by looking at maybe only acupuncture given or acupuncture and herbs, and then you can do direct comparisons of different approaches, and you can see what's really working across the board, across your whole base.
So we can see the benefits there on an individual practitioner level and the clinic level. And what ACU-Track is, as well as a tool for practitioners in clinic, it's a clinical registry. So what does this mean? It's built on the idea that, hey, what if we could all collect and record the results in our own clinics, in our own practices, and then combine them together into one big database? Well, this is what ACU-Track does. And it collects, crucially, only anonymous data from patient and practitioners, and collects them into this database so that we can build up that real big picture data of these complexity factors, so that we can start to really narrow down and learn which types of approaches and techniques are working best for which types of conditions and which kind of patients. That's the information that we want as practitioners from research, because that's the information that's leading us to learn and optimize our treatments and care. So we're trying to deliver the best results possible. And in this way, we're almost trying to build a collective clinical experience and optimize the way we're kind of sharing data and collecting data as a profession, so it's most useful for everybody. And you know, the potential for building this kind of database is just enormous. I mean, in terms of informing the college teaching curriculums and for students up and coming to learn this kind of thing. And also, as Ian was saying earlier, to inform future research, to make sure that these trials are informed by real world clinical practice, by the points and the herbs and the different techniques that are actually producing the best results for that condition, rather than something that they just kind of read in the textbook or make up on the couch. And so by using ACU-Track, you're also participating in, you know, what we feel is potentially groundbreaking research for our profession. And this data, of course, is going to be enormously useful for informing healthcare stakeholders, both on the kind of national policy and guideline levels, where they're increasingly interested in real world pragmatic research into informing what kind of treatments they recommend, healthcare insurers, and at the local level, GP practice, local NHS trusts, they want to see what kind of results patients are getting in their community. Medical disease specific charities often compile their own evidence-based guidelines. And finally, of course, the prospective patients and the general public.
So right at the beginning of our journey, we decided we would do a pilot. So we had a pilot phase where we actually put some treatments through a system. This was ahead of us taking on our kind of final favoured system, which was Amplitude. So the pilot phase, as you can see, well, it shouldn't be a surprise, really. It kind of tells you what you'd expect to see, that a lot of people got better, basically. If you look at the graph on the right, the green sections are the improvement sections, and that's around 90% of patients reported getting better. And you can see the chart on the left, patient satisfaction was 95.8%, very satisfied. So this is what we expected. This is what happened. The system proved it, and so we're really pleased with that.
Yeah, I'll just jump in there briefly to answer Julie's question. Spod, if you just want to go back to your slide.
Yeah.
So Julie asked, the own perception score, is that part of a plan or something separate? That's part of every plan. So no matter what plan you get on, we ask you how much you've improved, for example. And if you look at the pie chart there with the green, the clinical improvements, you'll see the scores from our pilot phase where we asked this question. So you can see there about 25% of patients very much improved, 40% of patients much improved, and about 26 minimally improved. So this is a really great measure. We found it worked really well in our pilot phase, and yeah, it's fantastic. So just to summarize some of the practitioner benefits, obviously, we're trying to make it as easy as possible for you to do research in your own practice, to record and demonstrate your clinical results, as well as learning from this, trying to optimize the treatments and care you're delivering to your patients, trying to get the best results for your patients. This data can be very useful for your marketing purposes on your website. You can be using those stats to say things like 90% of our patients did report an improvement for their main health complaint. It's powerful stuff. You can use this data to communicate with your local GPs, local NHS trusts, so they can see what kind of results the patients are getting in their local communities when they're going to go see their acupuncturists. And Spod showed earlier our kind of intake forms and our clinical notes. We're really proud of these forms. They're super useful. They're great. We've got a comprehensive list of all the acupuncture points you can think of, all the herbs and formulas under the sun, making it nice and easy for you to record your intake forms, record your clinical notes, streamline your whole kind of data collection process and clinical records, and store it all securely using one system. So we're working with a couple of really cool projects at the moment, and I just want to mention two of them here. Rebecca Avern's new community pediatric acupuncture clinic. We've developed some specific pediatric plans for them to use on ACU-Track, where they're going to collect outcomes from children and adolescent patients. We're really excited to see the results of this because pediatric acupuncture, we need more data on this. We need more research onto this. We're trying to build the grassroots database here. If you're a practitioner out there, you're treating pediatric patients in your own clinic, you can join Hopper, which is Rebecca's new hub of pediatric acupuncture. And I believe Spod's put this link up there in the chat if you want to go check.
Right at the top, yeah, right at the beginning.
Right at the top there. There's loads of great educational resources Rebecca's got there, as well as some mentoring, training and supervision. And you can also use ACU-Track, join in on that research project to monitor pediatric outcomes. The other one, we are desperately trying to make a acupuncture and TCM for long COVID study happen. And we need your help to do it. So for the practitioners out there that are treating long COVID in their clinic, getting good results, fantastic. We would love to have you sign up and get interested in taking part in this study. We're still in the early phases of planning it, but we're working with some of the leading researchers over in the US doing this. It's going to hopefully be a US and USA large pragmatic study for acupuncture and TCM for long COVID. Please do check out that link, read a bit more about it, and sign up if you're interested about hearing more. Have you got a project in mind? Have you got a local community acupuncture project or a multi-bed, or are you part of a group of practitioners who are using a particular style, treating a particular condition? Do you want to collect data? We'd love to help. Tell us about it. ACU-Track is really well placed to facilitate data collection for these kind of projects. So please do get in touch. We might have started the most niche of the niche podcasts on the whole planet with our new acupuncture research podcast. So for all the research nerds out there, please do check it out. We're going to be speaking with some of the world's leading experts, looking at the evidence base for particular conditions, how acupuncture works, and some of the controversial stuff. I'm just going to get a mouthful of water. Just
while Nick's having a drink there, if you listened to Ian's introduction, he was saying about the so-called placebo or sham acupuncture is not an inert intervention. And one of the points I picked up on in our first podcast is that one way of looking at the whole sham acupuncture thing is really bad acupuncture is actually much better than usual care, but not as good as really good acupuncture.
Yeah, that's exactly right. So, if you're interested in all these topics, check out our podcast. Again, the link's in the chat to everyone. And then finally, if you're interested in signing up, if you enjoyed the presentation, we got a great discount for BACC members, which runs until the end of the year. This is for 2021. You can sign up for £12 per month or £90 per year using the association code BACC 2021. We're really encouraging practitioners to get out there in your own clinic, start collecting data, doing research. We think this is a really great way to do it. And you can be part of quite a cool research project for our profession by taking part. So we'd love you all to consider signing up. You can look at our website for more information, send us an email, get in touch. We're always happy to talk. So thank you for listening, and we look forward to your questions.
Thank you.
It's awesome. Allegedly chairing. Can you hear me? It's not coming up.
Hi, Ian.
Hi. Oh, yeah, good. I haven't changed. Okay, so first of all, thank you both for a really, really good presentation. And just to sort of flag as sort of my role for research, of course, I want practitioners to be involved in research as much as possible. And as a general thought, I mean, if you can put in some questions, I'll potentially read some of them out. But as a general thought, that the British Acupuncture Council we're at a different epoch now, and we can be looking outwards to try and directly apply for funding for projects. And if we're going to some philanthropic organization or whatever, and we want to do some research, I think it's really useful to have a system such as this that hopefully the practitioners are familiar with. And because you've both and your partner done a really good job, I would say. I mean, the whole presentation is excellent. And I think practitioners can use that as a tool to sort of say, look, we want to do something, we want to work with these people, and this is how we're going to measure it. So it's really important that we as acupuncturists come across as professional as possible, and we embrace technology, which for some of us is a little bit of a challenge, but nevertheless, even if you're not that technically gifted, I think we can all acknowledge that there are huge gains to be had from these kind of new systems. I wrote my undergraduate study with pen and paper, but there you go. So we've moved a lot.
You have my sympathies, Ian.
So I'm just going to see if we have a question.
I think the first one that we haven't answered is probably Pia's one about the consent form.
Yeah.
So Pia was asking about is it possible for the patient to basically come in and fill in the intake form basically with the practitioner, so the practitioner can guide them, can sit with them and actually maybe do it with them. So you can certainly have a tablet in the clinic, and you can help them through it. And so Nick, I don't know if you've got anything to add to that.
Yeah, definitely. So look, the whole goal is to try and make it easy as possible by sending all this stuff to patients via email, but all questionnaires and intake forms can still be completed in clinic with the practitioner, whether that's on the same device or you've got a dedicated clinic tablet. We can show you how to set one of those up. So yeah, it's just whatever works best for different patients. You can adapt to that.
The next one. So we'll try and whiz through these as quickly as we can, because we've got until.
So I think we answered Julie, didn't we? And then there's
the next one, Nick, was, does the patient have continued access to their patient notes? The patient does not have access to their clinical notes. They'd have to request that specifically for it. The patient portal is just for them completing their intake form and outcome scores and things like that. So Wendy, I often use multimodal treatments, i.e. acupuncture with another form of therapy. Does your system allow for this evaluating the results? Or would it preclude me from using it? Also, do you use the SF36 questionnaire?
I can't quite see that one, Spod. Could you just
read that? So that's 1141, Nick. It was a direct message to me, actually, by the looks of it. That's why you can't see it.
Yeah. Could you just read that one out again?
So
maybe?
I often use multimodal treatments, i.e. acupuncture with another form of therapy.
Yeah, great.
Does your system allow for this in evaluating the results, or would it preclude me from using the system, in other words? Also,
it's fine. You can mark whatever interventions you use, acupuncture plus moxa plus cupping plus other whatever.
So
that's fine.
Do we use the SF36 questionnaire?
We do not, for a number of reasons. One is, as the clue's in the name, it's 36 questions long. It's quite an onerous beast. We use shorter forms because it's real world practice. It's more convenient to use shorter questions. Also, this is what we call a legacy measure. It's quite outdated now, really. So we use more modern, better validated measures than that. But the Promise Global 10 scale on our wellbeing plan is very similar in concept, but just shorter, more concise, and more practical.
So the next one was from Sally Anderson. Can practitioners access aggregate data to generate their own research? So I can probably answer that, Nick. So from your own clinic, your own patients, absolutely. You can download a view of that and filter it as we showed earlier. If you're talking about aggregate data from the whole of the ACU-Track Registry, so we'll have a process. So if you're doing legitimate research and you're a legitimate researcher, it is possible to get access to the aggregate data. At the end of the day, the main reason we're building this is so that we can disseminate really good data and get some really good research going. So we would have some kind of arrangement for legitimate research to be able to have a copy of aggregate anonymous data.
Yeah, I think there's one from Tess further up. Someone who started using ACU-Track. Thanks very much, Tess, for signing up. Lack of customer support and training. Can we do a webinar? Yeah, absolutely. We can do a webinar for new users, taking you through the A to Z of how to use the system, so practitioners can get confident getting started with it. Like using any new system, it just takes a day or so to kind of get used to it. But once you get going, really, it is all quite streamlined. But yeah, we can certainly look at organising a training webinar as well as our kind of videos. We've got customer support, by the way. It's 9 to 5, Monday to Friday. So there is support services with specific questions.
Another one from Julie Reynolds. If you only wanted to collect and see analysis of outcomes and not for patient notes, is it simple? Can you ignore that bit? Absolutely. The patient notes are optional and you can just, collect the outcomes. Lisa Collins. So what is the experience of clients / patients in terms of, are they willing to log in and complete the forms? Are they willing to engage in the electronic preamble before their treatment? So yeah, we'll get really good engagement rates. I think you've probably got some statistics on that, Nick.
Yeah, I quite like the phrase electronic preamble. But yeah, no, it's a good question. Do patients actually engage with it? Our pilot phase found that we had over a 60% completion rate for follow-up questionnaire forms. So I think the answer is yes. And look, this has been quite well studied in a range of healthcare settings as well. Patients are increasingly used to completing this kind of questionnaires online about their health status. Patients generally like telling you about how they're doing. They value the opportunity to do that. There's been a lot of good qualitative research on patient experience responding to patient health questionnaires as they're administered online. Overwhelmingly, they're actually quite positive. And patients like completing these forms. Basically, we kind of know this, And there's even some research to suggest that by using these forms, by using these questionnaires, this might actually be therapeutically active. It might actually add to the therapeutic relationship. I think the perception people have when they start using forms is it all becomes regimented and it's kind of a bit too formalized. It's actually possible that, you know, this adds value. Patients like being regularly asked, how are you doing? I want to make sure you're improving and getting the best results you can. So that's all really quite encouraging. So and, you know, especially due to COVID last year, patients are really used to using tech now. Even in, I think, elderly patients, we had an osteopathy app doing a similar thing, and the elderly patient group was amongst the highest response rates for these kind of questionnaires. So that, I think there are a lot of these misnomers we have about, do patients engage with it, that are improving and actually not true.
But however, being pragmatic, there's not to say that the occasional patient, if you think it's unsuitable, that you could leave them out. So, you know, it would be up to you as a practitioner.
Completely.
Okay, so the next one is, how long is the offer on for, I'm going to graduate in November 2021. So it's until the end of the year. So you should be okay. I do not have Wi-Fi in my clinic. Is the form online or downloaded on an app? You do need internet access, unfortunately. So without being too technical, although we call it an app, app is quite a generic term that is used a lot these days, but really it's a website. It's an application that runs in a web browser. So yes, you do need internet access, I'm afraid. Also, next one, do you see this working as standalone to clinic management softwares like Jane and Clinico, or does ACU-Track do the scheduling, etc. too? So ACU-Track doesn't do the scheduling, but we have got some links into the system where you can you can use your scheduling system, for instance, to send out the patient registration forms. The scheduling of sending out the outcomes forms and the reminders of those, that's all integral to the system. But primarily and by and large, the system would operate fairly separately, but we are actually in talks with some of the big providers, such as we're looking at Clinico. We're going to be talking to Jane. There's some others as well that we're actually talking to at the moment about having some kind of what we call an API integration process, so that the systems become seamless and actually can talk to each other. So that's on the to-do list, very much so.
Yeah. Sally Anderson asked, would it be possible to have a plan for chronic health or simply well-being? Yeah, so our well-being pain plan is really good for this. Yes, it has pain in it. If a patient doesn't have pain, they don't have pain, and it just doesn't monitor that metric, but it will monitor all the other metrics of general health and well-being. So that's a really good plan for that. And as well as a health complaint, you don't have to choose a specific health complaint. One of the options on there is just well-being or health maintenance, and you know, they can just say how well they're kind of doing. So yeah, you can definitely monitor overall health well-being as well with what we're doing. Will this app be extended to include TCM herbs? Herbs are on there. So if you do an acupuncture plus herbs, great. If you're just a herbalist, you can still use it. We've got a comprehensive list of all the different herbs formulas on there. So yes.
So Pierre Huber, did I miss this? Do patients have to download an app to fill in the form, or is it simply a link they go to? So just to explain then how the process would work. Let's say, for example, you're using Acuity to send as your scheduling system, and you want to send out a self-registration link to the patient. So you have your email template in Acuity that says, that tells you all about the treatment, etc. And when they're going to come along. So what you do is you put the link, you're given this magic link which relates to your own practice. You put this magic link into the template once and once only, and it's done. Then when the patient receives the email, they click the link, it launches the browser, up it pops, and it will dive straight into the patient portal, and then they're away then. So that's the process. I think that's the last question at the moment.
Yeah, unless anyone wants to raise their virtual hand and ask a question as well.
And that seems like it. I think, Ian, I think we finish at 12:05 anyway, don't we? So that's
I was going to say,
pretty
you
good
are
timing.
perfectly timed.
Ian,
Chairperson's
thank you
dream.
for the introduction, by the way, Ian.
No, it's great. It's great. I just no, I'll just make you blush. I think it's great.
Brilliant. Well,
Okay.
thank you everyone for your time and questions. Like I say, visit the website for more info. Get in touch with us via email. Yeah, thank you for listening.
Thank you.
Okay. Take care. Thank you.